Hello, my name is Dr. Teresa Delahoyd. It is my pleasure to review our poster titled Areas of Specialization Needs for Registered Nurses and Advanced Practice Registered Nurses Working in Rural Communities of Nebraska. My colleagues, who were the principal investigators along with me, include Dr. Lynna Bostwick and Dr. Juan Paulo Ramirez. To give you a little introduction to our study, we actually sent a survey out to all nurses working in rural areas in the state of Nebraska in the summer of 2020, asking them for 3 areas where they felt they needed additional education and training to provide safe patient care in their current position. Those 3 areas that were identified include mental health, diabetes, and trauma. So based on these results, we then sent a second survey in the summer of 2021 to identify the specific areas they felt they needed education on within those 3 specific fields. So the purpose of our study was not only to understand those specific areas of training and educational needs, but also to understand those motivational levels of RNs and APRNs working in rural communities in Nebraska. Our research questions are listed there, and our methods included a 10-item training education needs assessment survey, which again was delivered to all RNs and APRNs working in rural communities in Nebraska, and we utilized SurveyMonkey for that. We obtained their email addresses from the Nebraska State Board of Nursing's directory. In this survey, we also assessed their level of motivation to receive additional education and training, and this was measured on a scale from 0 to 100. The results of our study were a total of 231 surveys that we received, so we had a survey response rate of 14%. Although that may seem low, we were actually very happy with that considering that the study was during the middle of the pandemic. We had 56.6% of participants say they were RNs, 10.2 stated they were APRNs, 23.5 stated they were nurse administrators, and we had a handful that were travel RNs as well as stated they were other. In terms of demographic characteristics, these were not very different than the overall demographics of the state of Nebraska and the overall demographics of just the nursing profession within Nebraska. 97.3% of the respondents had a race ethnicity of white, and 97.3% of the respondents were female. The average age of the respondents was 49.3 years. The surveys were received from 80 different rural towns representing 62 counties of Nebraska, so we were quite happy with that we had such a broad representation across the state. Nurses were asked if there was a designated expert in their facility for these specialties, and over 70% of the nurses responded that they did not have any designated expert for mental health, trauma, and 2/3 mentioned that they did not have a designated expert for diabetes. You can see in Figure 1 the areas that they felt they needed more education and training in within each of those 3 major areas included management of a patient with a mental health disorder for mental health, for trauma, management of a patient with an ag-related injury, and for diabetes, updates on management of care for a diabetic patient. As I mentioned earlier, we also assessed the nurses' level of motivation for receiving additional education and training on a 0 to 100 scale. The results showed that nurses are slightly more motivated to receive training on diabetes when compared to trauma and mental health. Of all nurses who scored 90 or higher in motivation to receive additional education and training, those who selected trauma were significantly more motivated when compared to nurses who selected mental health. And APRNs showed slightly higher levels of motivation when compared to RNs. And all of that is depicted in Figure 2 on our poster. So some conclusions and recommendations. The majority of nurses mentioned management of patient either with a mental health disorder, diabetes, or an ag-related injury as priorities for more education and training. Over 2/3 of nurses working in those rural communities do not have a designated mental health, diabetes, or trauma expert in their facilities. And so this really is a focus for us to strengthen that collaboration with facilities that have those expertise so that rural facilities also can share and have some of those resources. Overall, rural nurses are highly motivated to receive additional education, and this is something that we're going to look at even further as we develop plans to be able to provide this education to rural communities. So next steps, we are working on writing a grant to be able to provide education to nurses in these rural communities, and we hope to have more information in the very near future. We thank you very much for attending this poster presentation.